been talking about the need for a Healthier Lancashire programme for nearly 2 years. So what I want to talk to you this morning is about where and who we are, what our vision and mission is, and what we've been doing so far. Andy will then take over and talk about the approach and the timeline and the governance. So some of you are from Lancashire, some of you may know it, but it is a complex health and social care landscape. We have 3 local authorities, we have 8 CCGs, 2 of whom are coterminous with Blackpool and Blackburn with Darwin's unitary authorities, and then Lancashire County Council with 6 further CCGs. We have a population of 1.5 million and a number of hospitals and acute trusts. Apologies to those from Morecambe Bay, because we've got Queen Victoria, which is the Morecambe Day Hospital, rather than RLI there. So many apologies for that oversight. Earlier in the year, we had a big summit in Burnley Football Club, so we're obviously doing the tours of the football stadia of Lancashire and Manchester at the moment. Over 130 stakeholders from across the health and care system, and all identifying a very sort of positive, enthusiastic need for doing things differently in our services, and a real aim for stopping people becoming patients, to really focus on the prevention agenda. To do that, we do need to collaborate, and we need to be clear on the things that we need to collaborate on. And our purpose is to define a new and better healthcare future for our health and care in Lancashire. So the team is a small team, but we've been working across the Lancashire health and care system, where there's already amazing work going on in different systems. We kind of have about 5 sort of ecosystems across Lancashire. And we know, for example, in the north, all the work on Better Care Together is already underway. There's some great work going on in Blackpool and Filed and Wire around developing new models of care to support the frail elderly with comorbidities, and developing an extensivist model. And we'll be all looking to see how that work plays out and how everyone across Lancashire can learn from that. Because we know that, I think Samira said, the future's already here. There's lots of really good work. It's about sharing that and getting the acceleration and reduction of variation. We've also been working on the Better Care Fund. Lancashire CCGs initially had their Better Care Fund bids not supported, so we've worked together to get a successful bid through there. It's all about relationships, developing relationships across the system with all our stakeholders. We have a Lancashire Leadership Forum, which has the leaders from all our different organisations, both statutory and voluntary sector organisations. And what we need to do now, and the work that's underway now, is really agreeing the scope of what's done locally, what's done collaboratively, and how we can do that effectively together. I just wanted to say one of the things we have been doing is around developing a digital health and care strategy for Lancashire. We have a digital advisory board, which is ably chaired by Sakthi, who's in the room. Thank you. And I think you're absolutely right when you mentioned earlier about the citizen being at the heart of everything. Unless they have the tools to be fully empowered, it will just be lip service, expecting people to take control of their own health and care. We've just been successful in securing $1 million from the Technology Fund, which is amazing, because that all just went into A&E, I think, over Christmas. So that will help us with our Lancashire Patient Record Exchange service, which we're currently developing to allow that exchange of information between organisations that provide care, but also with an end goal in sight of developing an individual health and wellbeing record that will allow the people of Lancashire to really develop and take control of their interactions with the services that support them, but also taking control of their own condition and making better choices around that.